What is Invisalign and how does it work?
Invisaligns are the clear aligners, alternative treatment for orthodontic braces that moves your teeth constantly, tray by tray, tray after tray, and it allows you to not to use braces, and instead you can go with the clear aligning treatment. Right. During the process of Invisalign, we place some attachments on your teeth. Those attachments are engaged into the trays, the clear trays that you put it on, and you change those trays probably every week, 10 days, or maybe 2 weeks. And every tray would have different alignment of your teeth. And based on the attachment placed on the teeth, your teeth will constantly move.
How long does Invisalign treatment take?
A comprehensive Invisalign aligners treatment could vary from 6 months to 2 to 3 years, depending on the complexity of the teeth. Right? Every patient's different. Every patient's teeth are different. Every case is unique by itself. So, depending on existing alignment and the amount of crowding you have, it could take up to 6 months to 2 years.
Am I a good candidate for Invisalign?
All the patients can be a good fit for Invisalign. Invisalign does not have any particular screening process for any candidates. If you have a teeth bite, if you have a crowding, generalized spacing, misalignment of your teeth, yes, you are a good candidate for the Invisalign.
How much does Invisalign cost?
Invisalign could cost from $4,500 to $7,000, depending on, again, level of complexity of the cases, depending on how many aligners do you require, depending on the duration of the case. It would be a good question to ask our receptionist to get more details on it.
Are there any food or drink restrictions during the treatment?
There's no restriction in terms of food and drinks. When you get your aligners at our office, our certified dental assistant will walk you through what to do, what not to do, how to take care of the aligners, what to eat and what not to eat, how to use the aligner when you're drinking your coffee, tea, or when you're eating your food. We'll be providing with you comprehensive details on how to take care of your aligners and the remaining process as well.
How do I care for my Invisalign aligners?
Just the way you brush your teeth in the morning and night, give it a good scrub, all the aligners where you put it on. Keep it nice and clean. You can use a regular toothbrush or electric toothbrush to keep it clean. And you would be changing your aligners every 2 weeks. You would be getting a brand new aligners every 2 weeks. So all you have to do is just like this, the way you brush your teeth, you brush your aligners and keep it clean.
Why is Invisalign better than braces?
Conventional braces has its own pros and cons. The biggest downside of the braces is the aesthetic side of it. Invisalign allows you to look more natural, more aesthetic. Invisalign allows you to be seamless when you smile, when you go to social gatherings. You don't feel conscious about having those metal attachments on your teeth because the attachment we put it on while the Invisalign is being done on your teeth, it's the same color of your teeth. So you don't clearly notice it. It, it seamlessly blends through your existing smile line, and it's very hard to notice unless you're a dentist like me. Aesthetic is the biggest side over the braces for Invisalign.
Can Invisalign correct overbite?
Yes, Invisalign can for sure correct the overbite. Depending on the level of complexity, again, you might need a few more aligners. Duration of the treatment could be extended depending on the amount of overbite you have. But yes, to answer your question, Invisalign does correct overbite.
Why do I need Invisalign?
When patients have significant amount of crowding, it does not allow them to keep their teeth clean. Over the period of time, if you have a deep overbite, then you would have more wear and tear on your teeth. In order to prevent any of these, Invisalign can help. Invisalign can open up your deep bite. Invisalign can align your teeth much better so that you can keep your hygiene up to date and prevent any further periodontal diseases.